oncologist as an on-site dermatologist available to answer any questions about skin-related toxicities that were coming up, and especially immune-mediated toxicities from immunotherapy. And so that role kind of really opened my eyes into the role of the dermatologist in providing supportive cancer care. And when I moved to Birmingham and I joined Total Dermatology, where my practice is um, mostly general dermatology, especially medical dermatology. I kind of continue to maintain that passion and seeing that um, population of patients and working closely with oncologists when needed.
Gotcha. Thank you so much for sharing that. And so my next question would be, how does chemotherapy, radiation, and hormone therapies affect the skin differently?
So, basically, all of them can affect the skin in different ways. Traditional chemotherapies or the cytotoxic chemotherapies, they have the widest range of dermatologic side effects. They can affect the skin, the hair, um, the nails, mucosa. And this presents oftentimes as like nail fragility, lifting of the nail, rashes, just a lot of different types of rashes, which we sort of classify as dermatologists based on, clinical exam and biopsies when needed. And also, just general dry skin can occur. And then, of course, hair loss. Radiation therapy brings its set of skin or dermatitis mostly along the site of the treated field. And so that kind of presents as an acute radiation dermatitis. Um, Longer after radiation, sometimes we can see sort of hardening of the skin. Also, some little superficial blood vessels may occur called telangiectasias post radiation. Um, Hormonal therapies can also bring about hair loss and dry skin, itch. Sometimes can um, bring some other itching and really dryness to the skin as well.
Yeah. So, are there any skincare practices you recommend during treatment? So, these could be things that people do like outside of clinic as they're going through treatments.
Yes, definitely. And so this is kind of in the realm of what we as dermatologists tell all of our patients, but especially it's been shown to be helpful in the supportive care during cancer treatments for the skin. So basically, what I recommend is using a very gentle cleanser, fragrance free. We want to use cream moisturizers. So, maybe at least once or twice a day before treatment starts, during treatment, after treatment. This can really help to maintain the skin barrier and prevent some of that dryness, itch that can occur. Um, Also, sunscreen or photo protection is the larger term, should really be maintained by all patients of all skin types. And so that involves using sun protective clothing, long sleeves when you're outside, wide brimmed hats. Sunscreen in particular is helpful. I usually recommend broad spectrum, so preventing against UVA and UVB rays, water resistant, and an SPF of at least 30 or higher. And then in some sunscreens, you have the chemical sunscreens and the physical or mineral sunscreens. And the physical and mineral sunscreens are the ones I tend to recommend just because they can be a little less irritating. They act as a barrier on the skin. Um,
Mhm.
but really, whatever sunscreen is going to work for you is a good option.
Gotcha. And thank you so much for clarifying like the difference between the types of sunscreen and like the compound. Because I feel like when you're shopping, you see like the different names and you're like, I don't really know how this differs from the other. In terms of like accessibility, does it matter where clients are buying these products or, do you have like a specific place you recommend?
No specific place. It's really just looking for those three main factors: broad spectrum, water resistant, and SPF of at least 30 or higher. Okay. And then when they're mineral based or physical based sunscreen, the primary active ingredient is zinc oxide. And so, but those are available really anywhere. So, not a particular place, but as long as just looking for those three main factors of sunscreen.
Gotcha. So next, I kind of want to dive into hair loss. So, do you have any advice that you would give to patients preparing for treatment related to hair loss?
So, hair loss is really, studies have shown that hair loss occurring in the setting of cancer treatments is probably one of the most distressing factors that can occur, side effects that can occur. And hair loss is distressing in the general population, and also, a lot of a high impact on quality of life, especially in patients undergoing certain treatments. And so I think the biggest thing is just establishing that support system, kind of like something that you have here, family, friends, just sort of acknowledging and embracing that, being prepared with like either wigs or certain hairstyles or scarves, things like that can be helpful just up front. So really just kind of understanding and embracing. We do see, with the traditional chemotherapy, there is hair loss. With the endocrine based or hormonal therapies, there can also be hair loss. Um,
Mhm.
so, I think just being aware of it and having a discussion with your oncology team as well as dermatology can be helpful. Now, as far as you know, treatments, usually that's kind of after the chemotherapy is done. If sometimes we can have a subset of patients that have this late alopecia or permanent alopecia after hair loss. And there are some options for treatment that have really been looked at that is safe in the population, the breast cancer population, especially after a discussion with their oncologist. But one one treatment is minoxidil, topical minoxidil, 2% or 5%. I usually recommend the 5%. This is after chemotherapy for alopecia that's occurred. 5% foam is available over the counter. Um, we also have a pill version, so low dose oral minoxidil has really been widely studied in all different forms of hair loss,
Mhm.
and it's been looked at in the breast cancer population too. And again, just having a discussion with your oncology team and also maybe getting in with the board certified dermatologist to discuss, what could be my options going forward is always helpful.
Gotcha. And you actually answered my next question. I was going to kind of go into what treatments are available currently for individuals who are, experiencing regrowth and might want to accelerate the regrowth after chemotherapy. Um, so my next question, what nail changes should patients expect during treatment? I know earlier you kind of talked about like brittle nail and sometimes the nails may fall off, but are there any other changes that might occur in terms of like the appearance, color, etc.?
Yeah, so basically, yes, we did talk about, you can have some changes in the nail lifting called onycholysis. You could have, some brittleness of the nails. You can get some redness around the nails. That's inflammation of the nail fold, like paronychia. Um, so basically, just kind of expecting this. Traditionally, I recommend patients keep their nails sort of trimmed short, sort of avoid any tight fitting gloves or shoes, just making sure shoes are well fitting. Sometimes minimizing water exposure. So if you do a lot of wet work or have your hands in water a lot, using some protective um, gloves, maybe even cotton gloves and then dishwashing gloves on top just to prevent a lot of water exposure, which can sometimes cause more um, irritation to the nail. Um,
Mhm.
and but yeah, those are kind of the main side effects to watch for. Now, I will caution on like using a lot of excess biotin. Sometimes we do see patients wanting to take a lot of biotin supplements because it might help with their nails or it might help. And we do use caution in recommending biotin because it can sometimes interfere with certain um, lab testing, like thyroid testing and another marker called troponin. And so we don't usually recommend significant amounts of biotin. And that kind of goes back to your last question about hair loss. I forgot to mention is that after chemotherapy, when we're kind of assessing the hair loss, whether it's presenting after traditional chemotherapy or if it's a factor of a hormonal treatment, we do, a lot of the times that presents as diffuse thinning, or it can also present as like a female pattern hair loss, and that's where some of the treatments come in. But it is also important to kind of check baseline labs like ferritin, thyroid function, things like that, vitamin D, just to make sure that we don't have anything underlying, and make sure we can address and treat that first, and then go on to use some of the therapies.
That's great. And so for these nail changes, would that occur like in the fingernails and toenails, or do you usually see it in one area over the other?
Um, Fingernails and toenails. Yeah, it can affect both. And so that's where kind of the recommendation just to kind of wear the well-fitting shoes, gloves if needed. Now, if something like that does happen, then we do have topical steroids. Sometimes
Mhm.
topical antibiotics can help, especially if there's a lot of inflammation around the nail. And then if it's really something like very inflamed, then we'll often use some oral antibiotics, just from an inflammatory standpoint to help as well.
Gotcha. So I'm gonna kind of shift gears just a little bit, but are there any signs that indicate a patient should seek dermatologic care rather than managing symptoms on their own? And what are your thoughts on managing symptoms at home?
Yeah, so that's a really interesting question. I mean, I think kind of if, definitely starting preventative measures like the moisturizers at home, the dry skin care, but you know, uh, it's been shown that the earlier that we can intervene, and that's where this whole role of oncodermatology or supportive oncodermatology comes in. But if there is a rash or itch that presents, then kind of helping to optimize the treatment and help with the symptoms can help patients stay on that life-saving cancer treatment. And that's kind of where our role as dermatologists is. And so, I kind of feel like definitely access is one thing that we need to, sometimes access is difficult. But I think if there's any rashes, significant itching that's just not getting better with moisturizers, it's important to bring up to your team and then kind of see if we can facilitate an appointment with dermatology, to make sure that that's addressed. Because if we can intervene with some type of treatment, whether it's, you know, better recommendations on moisturizers or topical steroids, or sometimes we do need to escalate to systemic therapies, then that can be helpful and we can work alongside the oncology team to help the patient stay on this regimen. And then,
Gotcha.
of course, like one other side of potential skin manifestation that could occur is, especially with radiation, some other combined therapies, and also depending on your underlying baseline risk factor, there can be secondary skin cancers. And so we
Mhm.
always do want to, we recommend everyone do um, uh, just a body scan, just looking for any changing moles, lesions, any bleeding or painful lesions, anything like that. It's good to seek dermatologic care early on.
Gotcha. And I guess this kind of goes into like my next question, but for those who are navigating survivorship, when do you recommend those individuals establish a routine with the dermatologist after treatment? So this is like post radiation or chemotherapy or whatever, within their treatment plan.
Yeah, so I mean, I think again, it's there's a wide range of dermatologic side effects and toxicities that can occur, and I think we can have a role with helping. early on, during treatment, as well as definitely after, because so many of these therapies are leading patients into survivorship, and there's a great need for addressing some of these dermatologic lesions or toxicities that persist. And so I think it's definitely important, with scars, there are some specific silicone based dressings, or sometimes if they're thickened, there's some potential intralesional steroid injections that can be done. Sometimes, with certain rashes, we have a lot of topical steroids, different therapies that we could discuss. And so I think it's important. And then, of course, just establishing a baseline, um, a relationship with dermatology to help with like annual skin checks, and just having access if any other suspicious lesions or moles pop up, then being able to address that.
Gotcha. So for those who are interested in starting like a dermatological routine, could you walk us through what a first appointment might look like, and what are some of the assessments you guys do during that time?
Yeah, so we will often, we treat a wide range of conditions, and a lot of the conditions that are occurring in the setting of cancer treatment, or cancer survivors, are uh, skin conditions that we see every day in the general population.
Mhm.
Hair loss, rashes. With some of the immunotherapies, they bring about, some chronic skin conditions such as psoriasis or eczema, which, are just get revved up with the immunotherapy. And so basically, it just depends on what you're coming in for. If it's a baseline skin exam, then we'll often have the patient undress into a gown, and we have a special light known as a dermatoscope, and it helps us to visualize moles and lesions. And it's just a good way to have a baseline evaluation. And then, of course, if there's any issues with alopecia, rashes, skincare regimens, things like that, then we can always address those as well.
Gotcha. And so this brings me to our last question. You kind of touched on it a little bit, but are there any emerging treatments that could be promising for cancer related issues in the field of dermatology?
So I think we're just getting more and more information on some of the manifestations of especially some of these newer treatments like the
Mhm.
immunotherapies. And so we're better able to characterize and classify sort of what is going on, especially with when you give immunotherapy and it revs up the immune system, fight off the cancer cells. We're also seeing a lot of immune related skin conditions, and
Mhm.
we're also learning that some of the treatments that we already have and some of the ones that are coming out can be used in that setting to again help the patient stay on their treatment for the cancer while also treating the rash and improving quality of life. And so I think that's just going to continue to further develop. And it's, and as we get more and more information about what some of these drugs are doing, and we know how to treat them better. So
Gotcha. Well, thank you so much for answering all of the questions I had for you. So I'm going to go ahead and stop the recording, and I'm going to open the mic to everyone who's on who has a question they'd like answered. So give me 1 second.
okay, thank you.
Yeah, you're welcome.